Now from Pittsburgh is Johns Hopkins senior scholar and infectious disease physician, Dr. Amish Adalja. Dr. Adalja, it's always great to have you on the show this morning. Look, this is a huge win for the medical community and really the whole world. Give us an idea of what went through your head when you first saw the news.
We'd all seen the phase 1, 2, and 3 data from Pfizer. It all looked very, very good. The safety profile looked good. So we knew that approval was going to be imminent all around the world. And we know that the FDA is evaluating this in the coming weeks. And I do think that this decision by the UK regulator makes the path even easier for the FDA because they're very closely in sync. So I think this is good news all around for the world.
So help shed some light on the timelines here and why we're seeing this approval happen in the UK before we're seeing it happen here in the United States.
So it seems that the UK used something called a rolling review, where as data accumulated, they were continuing to make judgments in real time about the vaccine so that when the package was completely finished, when the regulatory information was all at the threshold needed for an emergency use, they could make that decision very quickly. Whereas it seems, although the FDA has been engaged from the very beginning with these vaccines, they're going to wait to see what happens at this meeting on December 10, where these advisors will all pour through that information and make a decision. So I think it's a little bit different, the process, and that's why you're seeing the UK regulator come to a decision much quicker than the FDA will.
Dr. Adalja, I think there's a little glimmer of hope with this news from the UK and certainly with the FDA meeting on December 10th to move forward with the process here. And the idea that here in the United States, we are going to see some vaccines delivered to frontline health workers and perhaps those who live in nursing homes across the United States before the end of the year. At what point do things start to get better from a hospitalizations perspective, from a deaths perspective, when people start to get vaccinated? Because if we think about it, if the most vulnerable populations, the people who are most exposed, those who could be most affected by this, if they're starting to get it, then we should start to see some good news soon, right?
Yes, and it all depends upon how quickly the rollout can happen to nursing home patients, for example, because that's something that makes up the bulk of hospitalizations, that makes up a lot of the people that are in the emergency department and a lot of our deaths. So if we can get the nursing home population fully vaccinated by January or February, I do think you'll start to see breathing room in hospitals. We'll still have patients from the community that are getting sick and infected with this. We'll still see spread, we'll still see cases and exposures and all of that. But once you can get people to not require hospitalization because they're protected by the vaccine, then you will start to see hospitals change the way they operate. You'll start to see people breathe a sigh of relief. So I would say it's probably going to be a couple of months of vaccination before we get enough of the nursing home population vaccinated to be able to really forestall all of the bad consequences that we've been seeing.
So I guess my question would be, in the intervening months between now and let's say the end of January, when we could really start to see some improvement, I wonder if we're going to continue to see these 4-digit deaths that we're seeing, these figures that we're seeing every single day. And I guess I just wonder what your opinion is on what Americans just don't seem to be getting right now about the idea that we have to stay at home still. We are not past this. We are still in a very dangerous part. Is this COVID fatigue?
So I do think the deaths are going to continue to be high for some time. Remember, deaths lag. So when we do something, you're not going to see it reflected in the deaths for a couple of weeks. So deaths are probably going to be around the level that they are, especially because we have so much community spread, and this community spread is landing on vulnerable populations. I do think that COVID pandemic fatigue is very real. People are frustrated, and I think understandably so, that we've not had a coherent policy now 11 months into this pandemic, that we still have problems with testing. We still have long lines to get test results for outpatients, and then that test result comes back 4 or 5 days later. So I do think people are frustrated based on that. And I think they have to still realize, though, that this is a very dangerous infectious disease, that there are vulnerable populations there that are getting infected and putting hospitals all over the United States into a mode where they're worried about their capacity on a day-to-day basis, trying to create new beds and make sure their staffing levels are adequate. And I think you have to realize that these actions that people take, when they don't follow common sense precautions of wearing a face covering, trying to stay 6 feet apart from people, washing their hands a lot, avoiding crowded and congregated places, that what that directly does isn't something abstract. It ends up putting the hospital in your community into a problem. And I think that's what people need to wake up to, that this is a pandemic, and it doesn't mean you have to lock yourself in your house. It just means be careful. And so many people are not being careful, and the result is our hospitals are suffering for it.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.